All right, this is Dr. Eric Osansky, and I have with me Dr. Evan Hirsch. So Dr. Evan Hirsch, he's a world-renowned fatigue expert, and he's the founder and CEO of the International Center for Energy and Fatigue and the Virtual MD Initiative. So Dr. Hirsch suffered with fatigue for 5 years before he achieved resolution using the Fix Your Fatigue program that he pioneered in his medical practice. And then also he has a best-selling book, a podcast, and also online programs. And through these, he's helped thousands of people around the world optimize their energy naturally. And he's on a mission to help 1 million more. All right. And also should mention he helps licensed functional medicine providers transition to a successful virtual practice, which is big in this day and age in 2020. And also he's board certified in family medicine and integrative medicine. And when he's not at the office, you can find him singing musicals, dancing, and playing basketball with his family. All right. How you doing today, Dr. Hirsch?
Hey, Dr. Evan. Thanks so much for having me on.
All right. All right. And yeah, we'll have to shoot hoops one day. So
that's right.
All right. Well, so let's start off. So you've dealt with fatigue for 5 years before you achieved resolution then?
I did. Yeah, the story actually begins when I started my residency program back in 2004. I was in good health. I had just come off of a year off after medical school and before residency. I met my wife about a month in. We fell in love, and 3 months later, she had chronic fatigue and couldn't get out of bed. And that lasted for about 3 years. And I felt incredibly powerless. Here I was, supposed to be at the top of my game, asking everybody and their mother about, how to help this person, and all of my attending, my physician friends and whatnot, they couldn't help. I mean, the stuff was really limited in conventional medicine. And so she eventually got better doing a number of things from a natural perspective. And then I came out of residency. I started my business, we got married, we had a child, and then a couple of years later, I got fatigue, and it lasted for 5 years and just about destroyed my life, just about destroyed my business, just about destroyed my marriage, my relationship with my daughter. My brain fog was so awful that I couldn't remember anybody's name who I was treating. My energy was crap, so I could only help people for a couple hours a day. I had to keep hiring new practitioners in order to come on to help me out. So it was awful. And then I went through a process of, once I realized that I had to find all of the causes, and I just dedicated myself to that and was committed to it, that's when I found all of my causes, and I was able to get over my fatigue. And now I've helped thousands at this point.
All right. So you helped not only yourself and thousands, but you said your wife as well then.
Yes, yeah, I did, but I did a little bit. I mean, at that point, she actually learned and taught me a lot about adrenal gland dysfunction as well as toxicities. And she got mainly better by taking some adrenal support. We got a sauna, so she was using that every day, doing some coffee enemas, and then the emotional work that she did was huge.
All right, very good, very good. So how does someone know that they have fatigue?
It's a good question, because a lot of people are like, they think that just because they're getting older and they're getting more tired, it's just because they're getting older. But that's really not the case. If somebody is sleeping 7 to 9 hours of sleep a night and they're still tired during the day, where they need coffee or they need Red Bull or they need 5-hour energy drink or Coca-Cola or whatever it is that has caffeine or some sort of stimulant in it, then there's something not right. And fatigue is just a harbinger. It's just ringing the bell and saying, hey, there's a problem here. You need to pay attention. Otherwise, bad things are going to happen. So that's how you know if you have fatigue.
Okay. All right. Yeah. As you know, my audience consists of people with thyroid, autoimmune thyroid conditions, Graves, and Hashimoto's. And so I would say more so with Hashimoto's, even though still a lot of people with Graves also have fatigue. I personally, when I dealt with Graves, and I can't say I had a lot of fatigue, but some of my patients with Graves have fatigue, but more common with Hashimoto's, hypothyroidism due to the low thyroid hormone. Mm-hmm. So that's one common cause. But you also mentioned adrenals in your wife, and I also see that a lot in my practice. So what do you see as, besides thyroid, besides adrenals, what are some of the other common causes of fatigue?
So what I've found is that there's actually 10 categories of causes, which can be broken down into 33 different causes. And these can really be divided up into deficiencies and toxicities. So let's focus on those top 10 causes. So the deficiencies are things that aren't in the body that are supposed to be. So these are deficiencies in things like hormones. We talked about adrenals, thyroid, sex hormones, deficiencies in nutrients, so vitamins and minerals, deficiencies in lifestyle habits, so not enough water, not enough good food, not enough sleep, not enough good movement. And deficiencies or dysfunction in mitochondria, which is the energy center of every cell in the body, produces about 70 to 80% of our energy. And then when we're looking at toxicities, we're looking at things like heavy metals. 70% of all the lipsticks that are sold off the shelf have lead in them. 100,000 pounds of mercury are being dumped into our oceans every year. Every time we bite down on a mercury filling or a silver filling, whatever you want to call it, amalgam, mercury vapor gets released into the body and we swallow it. Chemicals, 84,000 different chemicals we're exposed to on a regular basis, and most of those have not been appropriately evaluated for human use. When we're looking at something like mold toxicity, about half of all the buildings in first world countries have water damage, and most of those have molds. It's a crazy issue, that causes so many things from fatigue. And what's interesting too, for your tribe is that all of these causes of fatigue are also causes of autoimmunity. So if you've got Hashimoto's, you've got Graves', and those are autoimmune conditions, and the toxicities are going to be the same for them as well. And we can talk a little bit about some anecdotes that I've learned about those along the way. So that's mold. And then infections. CDC came out a couple years ago and said, actually, it's not 30,000 new cases of Lyme every year. It's actually 300,000. And we see everything from Borrelia, which is Lyme, to Bartonella, to Babesia, to Epstein-Barr virus, to now we're seeing COVID. And then there's allergies, which will be also part of that toxicity picture. And then the mental emotional stuff, so negative emotional patterns. And so that helps you categorize a little bit, simplify a little bit, all those deficiencies and those toxicities. Now, what's interesting is that everybody has a different combination of those, and so that makes treatment even more challenging. So for me, I had about 30 different causes of fatigue, but there are some people who will have, and pretty much everybody that I see has around 20 plus causes. But the 20 plus causes that Joe Schmo over here is going to be different than the 20 plus causes that Sally has over here. And so that means that their treatments have to be different.
Yeah, no, makes sense. And so some people just assume that they might have one cause of fatigue. So again, in the case of Hashimoto's, they might blame it on the thyroid. And again, that might be a big factor, but it could be adrenals, it could be, infection related, it could be environmental toxin related, it could be, mold, mold. Yeah, you're right. Mold toxicity is huge, nutrient deficiencies. So yeah, it definitely can be challenging. So in the case of, let's talk about nutrient deficiencies a little bit. So in your practice, do you address nutrient deficiencies primarily through food, through supplementation, a combination of both?
Combination of both. And I find that what's interesting too that I should mention is that these deficiencies that we talked about, hormones, nutrients, mitochondria, lifestyle habits, except for the lifestyle habits, the other ones really can be caused by the toxicities. So the end goal is to remove those toxicities that we talked about, and that will really help with those nutrient deficiencies. But yes, we do what we can, but there are certain nutrient deficiencies that I do like to replace, like vitamin D, magnesium. Vitamin B12 can play a huge role in energy and sleep and mood. And those are kind of the big ones. Oh, and then iron, if somebody
Yeah, I
has
was about
iron
to say
issues.
iron, yeah.
But one of the interesting things with iron, when you do as much work with infections as I do, iron feeds infections. And so I do have to be cautious about replacing. Now, I'll only really replace if somebody is very deficient in iron.
Hmm.
So if they're around 40 or 50, it's kind of borderline for me. But if they're less than that, generally I'll give them some replacement with herbal iron support.
So in the case if they have an infection, obviously you'll want to address the infection. Will you try to do other things to help with iron absorption in the meantime, like vitamin C, increased stomach acid, or will you just really focus on that infection?
I'm usually focused more on the infection. When there's
Mhm.
20 plus different causes that people have, and they're going to take one, sometimes two supplements for every single cause, it kind of gets a little crazy in terms of the number of supplements. And so we try to keep that as simple as possible. And if I think that the iron is going to be the biggest bang for the buck, then I'll go
Mhm.
ahead and give them and recommend that they take it. But for most of the time, it's not going to be the case, and then I'm gonna look elsewhere for the biggest bang.
All right, good deal. And then you mentioned Lyme. So some of my audience knows that in 2018, I was actually diagnosed with chronic Lyme.
Mm.
And I can't say I had more neurological symptoms. I can't say fatigue was really bad. It was more neurological. But I think a lot of people overlook infections. I mean, maybe a little bit more aware with like Epstein-Barr, for example. There's now there's books on both Epstein-Barr and Lyme. But I know before I was diagnosed with Lyme in 2018, I would never have imagined that I'd have Lyme disease. And even when I was diagnosed, there was no evidence of a tick bite. There was no bullseye rash. So it's definitely possible that for some people, I'm not saying everybody who has experiencing fatigue, but even if you have no evidence of, again, tick bite, bullseye rash, uh, it still could be Lyme. It could be, I also tested positive for Bartonella. You mentioned Bartonella before, not unfortunately not Babesia, but yeah, can you talk a little bit more about infections? Do you find infections then in a like high percentage of your patients?
I do. Yeah, the people that I'm seeing who have chronic fatigue, infections are very prevalent. So what's interesting about the infections is that even according to the Centers for Disease Control in Atlanta, the infections really are clinical diagnoses. So labs aren't great. And so what we're looking at is conglomerations of symptoms that can determine whether or not somebody has a particular infection. And then we can treat it using specific herbs. And then if we see improvement, that can corroborate what we're seeing based on the clinical picture. So for example, Borrelia, which is also known as Lyme, Borrelia, you can't really have Borrelia unless you have the following symptoms. You have to have symptoms that move around the body. And so we're talking about whether it's nerve pain or joint pain or muscle pain, where one day it's here, and then either a couple days or a couple weeks or a couple months later, it's, in the right knee or something like that. So it's kind of moving around the body. And then the symptoms have to come and go, where you don't know whether or not you can set an appointment for a certain day, because you don't know how you're going to be feeling that day. So some days might be okay and other days might be crap. Usually days aren't great, but some days are better than others. So you have that sort of come and go. If you don't have those symptoms, there's very few things that cause that. If you don't have those symptoms, you really don't have Borrelia. Now, with Bartonella, oftentimes where people will report symptoms of headaches or migraines, neck pain, body pain. Oftentimes, these people are misdiagnosed with fibromyalgia. They'll have problems with sleep. They'll have anxiety and depression or depression. They'll have pain on the bottom of the feet. And you may not have it now, but if you've had it in the past, if you've been diagnosed with plantar fasciitis, which is a condition that can cause some of that pain or burning on the bottom of the feet, then it's very likely that you have Bartonella. Another symptom is muscle cramps, oftentimes in the calves, oftentimes at night. And then sometimes people will report stretch marks. They'll say, out of the blue, all of a sudden I have this stretch mark right here, and I haven't had any weight fluctuations or anything like that. And then one of the biggest ones is Hashimoto's. In fact, the only way that I've ever been able to get people off of their thyroid medicine is by treating Bartonella. And
Hmm.
there seems to be some sort of correlation there, and it happened quite serendipitously, where I had just started treating somebody for Bartonella who was on thyroid, who had Hashimoto's, And she calls up after hours and she's like, I don't know what's happened. I'm flipping out. I've got anxiety. I can't sleep. Da, 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 da. And I said, I didn't know what to do. I was like, well, when was the last time that this happened? And she's like, when I had Graves. And I said, oh crap, she's hyperthyroid right now. I said, well, let's decrease your thyroid dose. And so slowly we were able to wean her off of her thyroid medication completely. And I find that about 50% of the time, we're going to decrease people down to about 50 or 25% of what they were taking when
So,
they have Bartonella as well as low thyroid. Yeah, go ahead.
so that's because you mentioned Graves. So you meant Hashimoto's, or?
No. So she said the last time I experienced this was when I had Graves. So she had Graves that then turned into Hashimoto's,
Okay,
right? Because
so you
most
have
time
the
people have
antibodies
both,
for
right?
both. Okay, okay.
Yeah. And so she was hyperthyroid, and because
Mhm.
I couldn't figure out what was going on. And she said that it was last time she experienced it was when she was hyperthyroid.
Okay. All right. Yeah. No, that's interesting, and a few things that you mentioned, which is worth repeating. So one, you mentioned the testing. So the testing, you're right, especially for Lyme. I mean, I was lucky in that the test it was clearly Lyme, but there are some people, especially if they go to like a LabCorp, Quest Diagnostics.
Mm-hmm.
I mean, if it comes out positive, then yeah, you probably have, let's say, chronic Lyme or Bartonella, whatever you're testing for. But if it's negative, it can definitely be a false negative. And so there are other labs, there are special labs out there. Some doctors might argue not even using labs and just going by symptoms. And that, that's another thing too. So what Lyme, I definitely had fluctuation of symptoms. I mean, it did move around. Again, I can't say I had classic like fatigue. I really didn't have, and I wouldn't say it was pain, but I mean, I had kind of electric shock sensation. So it was, yeah, maybe you could classify that under pain, but yeah, it definitely moved around, and some days it felt okay, some days it didn't feel okay. So yeah, you are correct. Another thing though is just my experience. Just everybody is different. So I didn't have classic symptoms, and that's why I
Right.
wasn't sure if it was Lyme. It's just I started to have a weakness in my leg, and then I there was with the other symptoms too. I was thinking either Lyme or MS, and the only reason I thought Lyme is due to my experience working with other patients with Lyme. But yeah, you just symptoms are important, but sometimes just like I'm bringing this up because if you're not experiencing some of the symptoms or even any of the symptoms that Dr. Hirsch just mentioned, doesn't mean that you don't have Lyme, doesn't mean you don't have Bartonella. And again, I'm not trying to say everybody has Lyme or Bartonella or I mean, we all have microbes, we all have viruses in us. A lot of us have Lyme and we don't know it, and it might not cause a problem. I mean, I might have had it in my body for years, and it just one day. But anyway, just wanted to reinforce that. So, so just in summary, just in conclusion, with the infection, so you do see it a lot in your. Actually, before I say in conclusion, how about Epstein-Barr? Because again, that's also just most people do have Epstein-Barr. Is that a big problem in most people, or is it most people they just have it and you don't really see it being problematic?
It can definitely be problematic as well. Oftentimes these people are going to report sore throat, but the symptoms are generally more vague. So they can just have fatigue without any of the other things that I mentioned. And oftentimes that means that there's a virus present that we need to go after. The other infection that I didn't mention that's pretty prevalent is Babesia. And Babesia is considered the North American malaria, and oftentimes people will report getting hot and sweaty from time to time or having night sweats on occasion, and it's cyclical. So sometimes it's once a month, and as things worsen, oftentimes it can increase to every few days. These people generally have awful sleep, so they'll say, I didn't sleep at all last night. And they'll have really bad mood, where anxiety to the point of panic attacks and depression to the point of suicidal thoughts. And then they'll also have some shortness of breath or some air hunger, can't get a deep breath. You don't have to have all those symptoms, just like with Bartonella or with Borrelia, but you just have to have some of them in order to start thinking about some of these infections.
Yeah. All right, and we will get to questions. If you have questions, we'll spend a few minutes on questions, but just want to pick your brain for a few more minutes. But one person, Denise here, I did want to bring this up since it's on that. So, because we're taking for granted that everybody knows what, these co-infections are. And so one question Denise had is Bartonella. What is that? So do you want, it's co-infection of Lyme disease, but you could have Bartonella without having Borrelia, without having Lyme, correct?
Correct. Yeah. So Bartonella is a bacteria that lives in upwards of 50% of all domestic animals. So if you've ever been licked in the face by an animal, or they licked your hand and you put it in your face, most of us have it. I think for me and my Bartonella that I've had since day one, because my mom actually has it. So if you're seeing some symptoms that kind of traverse from parent to child, oftentimes it can be transmitted through the placenta. So a lot of this stuff, these bugs don't become opportunistic until you get a number of hits. So whether it's another infection, or whether it's, for me, it was mold and medical school and residency and a breakup and like all these other things. So a number of stressful hits that ended up allowing some of these infections to come out in my body. I also grew up in New Jersey, so there was tick bites and stuff like that too. But to answer the question, Bartonella coming from these domestic animals, but oftentimes acutely, it's called cat scratch fever, where you get scratched by a cat, you get a very large lymph node, usually in the axilla or in the armpit, could be up here as well, but generally in this area, just proximal or closer to the body than where the cat scratch was, whatever side of the body it was on. And oftentimes that gets treated with antibiotics and it goes away over time. But what this is we're looking more like chronic Bartonella, where the Bartonella ends up getting deeper into the body. It'll have a couple of different phases. One phase is where it's living in the skin, when it's causing some of those stretch mark rashes, or what are called Bartonella striae. And the other one is where it's living in the blood vessels. So anywhere that the blood goes, Bartonella can go, which is why it's so pervasive over multiple different systems in the body, like I mentioned, going from the thyroid to the musculature to the joints. So hopefully that helps explain what Bartonella is.
All right. Yeah. No, thank you. Thank you for that explanation. And so you have something called a 4-step fixture fatigue system. Can you discuss this, like how you use this to help with causes of fatigue?
So my 4-step process is, if you haven't gotten the takeaway from this whole talk, is really it's all about the causes. So the first step is figuring out the causes that you have. And so it's that 33 potential causes. Everybody has 20 plus. So the question is, what 20 plus causes do you have? So we take you through a process of looking at what your symptoms are first, and then what labs you need to get to confirm those symptoms, and then to determine other causes. So what I found is that 75% of all of these causes can be determined by your symptoms alone. So very quickly, you can start the process, print out the workbook, go through it, and within a couple of hours, you're going to know 75% of your causes. So that's the first step, is determining those causes. The second step is to replace the deficiencies. Now, I should say that this process is all about step 4, which is removing the toxicities. That really is the most important step. But we have to do step 2 and replace the deficiencies in order to get you feeling better, in order to be able to tolerate the rest of the process. So that's replacing the adrenals and the mitochondria and the thyroid. I call those 3 the big 3, because they're the fastest way to shift somebody's energy. And then there's also working on your lifestyle habits, making sure you're drinking enough water, getting enough good food, not eating crap food and food toxins, making sure that you're getting enough movement and getting enough sleep, and then replacing any sort of vitamin and mineral nutrient deficiencies as well. So that's step 2, is replacing those deficiencies. Then step 3 is opening up the detoxification pathways. So in order to jump into step 4 and grab the toxicities there and pull them into the bloodstream so that they can get out of the body, you have to make sure that those pathways, those detoxification pathways, are open. And so that's making sure you're pooping 1 to 2 times a day, ideally twice a day, making sure that the liver is open, that the kidney is open, that the lymph is open, which is the garbage system of the body, that the neural lymph is open, which is the brain lymph. So that it's like these tubes where if you're going to grab those toxicities and pull it into the bloodstream, now they can come out. So that's what, when we use, all this stuff is natural. When I operate across state lines in these programs, I'm operating as a coach. So that means there's no prescribing. It's all education and recommendations using natural stuff. So that's what we do for step 3. And then going into step 4, it's removing the heavy metals and the chemicals and the molds and the infections and the allergies and the negative emotional patterns. And so that's binding them up, it's pulling them out, it's making sure along the way with all these nuances, because as you start killing off infections and removing toxicities, you're creating a new normal. So if you haven't been healthy for a period of time, 20, 30, 40 years in some cases, or even just 5 or 10 years, we have to hit the reset button. And oftentimes that can be a little bit bumpy. So what we're looking for is a 5-step forward, 1-step back process where you're continuing to make forward progress. You know, a journey of 1,000 steps begins with a single step, right? And so we want to, if you are doing 5-step forward, 1 step back, you are eventually going to reach your goal. Just have to know that it can take some time in order to be able to do so, and that there are some nuances to this, which is why a big part of our program is the follow-up, is the online community that we have. It's the group Zoom calls that we have in order to make sure you get your questions answered so that you can continue to make forward progress.
All right. Oh, that sounds great. So even though you're a medical doctor, so you could prescribe medication for, let's say, again, getting back to Lyme, you could prescribe antibiotics, or for toxic mold, you could prescribe cholestyramine, which could bind to mycotoxins. But you try to do as much as you can naturally, especially when you're doing, like you said, like the group programs, correct? There's no prescriptions typically.
Exactly. Yeah, there's no prescriptions. And I'm not really using my MD so much anymore because I've found really great tools naturally.
Mm-hmm.
And operating as a coach instead of an MD allows me to help more people across state and national lines. About a third of all of our clients right now are in the European Union and beyond. We're actually changing the time of our group Zoom calls to better accommodate them, because right now they're at 1 o'clock. They're a little bit too
Yep.
late for the EU. So we're moving a little bit earlier in the day.
Yeah. There's some a good number of people in Europe in my group, and in my and I have patients in the UK too. So yeah, so this time there might be people watching from the UK here, or not just UK, but other areas in Europe. But what was I going to say? Oh, the deficiencies. So just going back to the deficiencies, you said the 3 main deficiencies. Did you say adrenal, thyroid, and mitochondrial dysfunction, or?
The big 3, that's right.
Okay. All right. And mitochondria typically, most like I mean, there's a lot of things that could affect mitochondria. We could probably just have a separate talk just on mitochondria alone. But do you find that nutrients are like the biggest factor, or infections that drag down the mitochondria, toxins, or I guess all of the above?
Yeah, it's always a combination of the above. So the way that I describe it is that the mitochondria gets squashed by all of these toxicities, the heavy metals, chemicals, molds, and infections. And then you have to remove those toxicities, but then you also have to inject some love into that mitochondria in order to bring it back to life. So it is that 2-step process.
All right. So as you mentioned, there's so many potentially causes of different causes of fatigue. How do you know when you can or cannot help someone who is experiencing fatigue?
So it really depends on what's been done before. So if somebody has addressed all of their causes of fatigue, they should be better. So generally, if somebody has not, or if they haven't addressed them appropriately, then that's where I can help them. Because essentially, it's really, if you break it down as simply as possible, it's a 2-step process. You find the causes that you have, and then you fix those causes with a particular treatment that works for that cause. So either somebody hasn't found the causes, or they haven't found the right treatment for those causes. Because I've really never met anybody who has found all the causes, taken the appropriate treatment for them for the appropriate amount of time, and isn't better.
All right. So really, it just comes down to that 4-step process that you have. Yeah, and you're right that just there's again just so many different factors, and some people might, again in the case of Hashimoto's, maybe the low thyroid is causing problems a big when it comes to fatigue, so they might be taking levothyroxine or desiccated thyroid, and maybe that does help a little bit, or maybe they take it and they don't notice any difference, and so you have to look at adrenals and again nutrient deficiencies, just so many different things. So I mean, it really depends on the person. There are people who are able to make some changes and see dramatic improvements in their energy levels. And then there are some people, I'm sure some people who might be watching now who just have had fatigue for years. And it seems like no matter what they do, they my Facebook group. So again, this is being live streamed into two of my Facebook pages and my Facebook group. So yesterday, in preparation for this call, every day in my Facebook group, or at least Monday through Friday, I just put a little, I put a post. And so yesterday I did put a post like who in the group is experiencing fatigue to kind of prepare them for this call, just to let them know that we're going to be talking about it. And just I was, looking at some of the comments, and yeah, a number of people have been experiencing it for years. It's one thing to experiencing it. It's bad enough for a few weeks or a few months, but experiencing severe chronic fatigue for a long time. So there's definitely hope. It's not always an easy process, but yeah. So definitely want to encourage people. Again, we'll get to some questions in a minute or two, but just wrapping things up. Well, first of all, I wanted to thank you for getting together and for this interview, Dr. Hirsch, but then also for more information. So Dr. Hirsch, first of all, he has a book, Fix Your Fatigue, the 4-step process to resolving chronic fatigue, achieving abundant energy, and reclaiming your life. And even though it is available on Amazon, there's where actually I'm going to put this in the chat. And again, I might have to do this separately. This I'm going to put in the chat this link where people could get a free copy, a free PDF download of your book. Again, it'll go to the pages. I'll probably have to do it separately with StreamYard when it doesn't go into the Facebook groups because it's private. So anything that I type here, so I'll have to do that separately. And so let me put that there. And then also, if they're interested, when they've, because this also, I think also will lead to your website, because you also, they could schedule a free call as well if they wanted to chat with you or one of your coaches to learn more about how to overcome their fatigue. Is that correct?
Correct. Yeah, to see if they're a good fit for any of the programs that we offer.
Okay, cool. But yeah, a good place to start maybe is to get that free book, and then yeah, or again, if you feel like you want to schedule a call, definitely he's here. He's ready to help. But let's see if anybody has questions. Well, actually, before we dive into questions, any last words? Anything else that you'd like to say, Dr. Hirsch, I didn't ask you? Or
I think there are two things. So the first thing is I just like to give you a quick take on my take on thyroid, where besides the Bartonella piece, what I find is that and I'm sure you see this as well. Doctors are so reliant on their labs that if I had a nickel for every person who was undertreating their thyroid, I'd be a very wealthy man, right? So I do what's called a subjective ramp up, where we use glandulars, which are obviously natural, and we ramp up every 2 weeks in order to get people up to their top dose. Because I find that thyroid helps everything. What's the best blood pressure lowering medication? It's thyroid. What's the best cholesterol lowering medication? It's thyroid, right? But I also ramp things up in a specific format where you've got to replace the adrenals first and then replace the mitochondria before you go after the thyroid, because the adrenals and the mitochondria will both make the production of thyroid better, its absorption better. And so you're improving thyroid function along the way. You don't want to kind of ramp up on your thyroid without kind of working on the adrenals and the mitochondria. So that's kind of like my 2 cents on that. And then the second thing is really about encouraging people to stay in action. Make sure that you're moving forward. Make sure that you're working through Dr. Eric's plan. so that you are going to be successful. If you have questions, you ask them. It seems like the hardest thing for humans, and I totally get it, it's just kind of part of our nature. Like if we get stuck, sometimes we don't know what to do. So make sure you're asking questions, make sure you're staying in action so that you can go through and you can be successful, because we really underestimate the amount that we can get done long term. In the next couple of years, we overestimate the amount that we're going to get done in a week or two, right? So you have to remember that baby steps and taking that 5 steps forward, 1 step back will eventually get you there. You find a good mentor like Dr. Eric or myself, and in 3, 6, or 12 months, you're going to have a very different life. And you think about that, and it's not a lot of your life. It's 1/80th of your life, depending on how long you live. And it can transform your life when you find that right person, that right mentor, and you take action.
All right. Well said. Well said. All right. So yeah, no, definitely want to take action, and yeah, that was that interesting with the thyroid. I mean, yeah, the adrenals. I talk about this sometimes too. Adrenals, priority over thyroid and sex hormones. Again, Hashimoto's is immune system condition. So, but you're also talking about like I guess make sure I understand you correctly. Like before giving like a thyroid glandula, for example, you'll optimize adrenal and mitochondrial health. Is that correct?
Absolutely. Yeah. And then I see it as two separate conditions, as I'm sure you do, where you have to replace adrenals in Hashimoto's because you've got replace thyroid because you've got the low thyroid, but then also working on the autoimmunity.
Yep. Yeah. All right. Well, thank you for sharing that.
Yeah.
And again, thank you for sharing all this with everyone. And let's see if there are any questions here. So we got not a question, but Cherie says, thank you for sharing this, and you are very welcome. And okay, and then we got Ranjitha. Just like me, recent blood work shows have Hashi's antibodies that are active, but it looks like her issue is brain fog. So I don't know if you want to say something quick, like for and I do have on my website some information on brain fog, and I know an article I wrote. But what would you say for someone who's experiencing brain fog? Like maybe some, like is there overlap with some of the causes of fatigue when it comes to brain fog as well?
Yeah, unfortunately, it's very much commingled. Brain fog was one of my worst issues, and the causes are the same. And generally, it's never just one thing. I mean, sometimes there's one thing predominant, like mold, but it's never just one thing. And so sometimes it's like you start taking adrenal and mitochondrial and thyroid support, and all of a sudden lights come back on. And other times it's all about getting to a certain point and removing the mold out of the body.
Yeah. All right. So really all comes down to addressing the cause,
The causes.
underlying
That's right.
imbalances. Yep.
Mm-hmm.
All right. Let's see. We have Michelle here. So interesting information. I was diagnosed with Graves' disease a few years ago, and now I think my thyroid is going the other way due to weight gain. So not taking any meds at the time. I appreciate the expertise on all these issues. All right. Well, thank you, Michelle, for tuning in. And let's see. We have Tisha here who needs a reset. All right. Well, yeah.
Amen. Hit that reset button.
Yes. All right. Any other questions? I think so far. I know sometimes when I do these, a lot of times I'll do these. Actually, most of the times I'll do these solo, and I have to, encourage people just, going once, going twice, and then we'll whole flood of questions. But seriously, if there's any questions that you have for Dr. Hirsch, just definitely let us know, and especially anything related to fatigue. But we do have a question here from Norway. All right, so dizzy all the time. So why? And again, there could be numerous causes: adrenals, infections. I'm sure Dr. Hirsch could expand on this as well.
So one of the main sites that autoimmunity loves to go to is the cerebellum. So it loves to attack the cerebellum, which is the balance center of the brain. So that's one of the reasons that I see. And so anything that can be triggering that autoimmunity, triggering the immune system to attack itself, once again comes down to those toxicities: heavy metals, chemicals, molds, infections, allergies. And so that's generally where I will go and have success doing so.
Yeah, toxic mold is really big. I mean, just I mean, usually someone will have more than just dizziness, but definitely
Right.
that's one of the potential symptoms. But yeah, do you notice also where it's, well, I guess you kind of answered this earlier, so just where people don't have just one thing, but just like if someone has a chronic infection, a lot of times they also do have mold, and you know, and a lot of times it could even be like where one, like the mold, the mycotoxins kind of dragging down the immune system, potentially
Yep.
making them more susceptible to infections such as Lyme, Epstein-Barr. Um,
Absolutely.
yeah,
And I find, and there's some research to back this up, that when you remove the mold, people who have these infections get better. So it's the immune system wants to bring everything into
yeah,
balance, right? And so it just gets hamstrung, where basically you've got heavy metals, chemicals, and molds that have hijacked the immune system off into left field, and these infections are having a party. So once you can bring that immune system back and get rid of some of those toxicities, it makes a huge difference for getting rid of the infections.
yeah. Yep, no, great points. And let's see, we got Jessica here. So with Hashimoto's, I've struggled with both exhaustion and insomnia. So first steps to feel normal. So again, definitely encourage you, Jessica, to sign up for Dr. Hirsch's free, to get the free book. There's that. Actually, I'll post. It's posted in the again the pages. I'll have to post it separately if you happen to be in the group. But this is the link. But yeah, what besides getting your book, which again normally it's not, like if you go on Amazon, it's not a free book. So this, yeah, if you go on Amazon, you could get it, but it will be. But if you want it for free as the PDF, visit that website. But what besides reading your book, what's the first steps that you would say for?
So the first step is always adjusting lifestyle habits. So it's making sure you're getting 7 to 9 hours of sleep a night, going to bed and waking up the same time every day. So 10 to 6 would be a good 8 hours. Going to bed around 10 or 10:30. After 10:30, oftentimes people get an additional wind. And so you want to make sure that that timing is as such. You want to make sure that you're consuming enough water. And if you're tired, most of the times you've got adrenal gland dysfunction, you want to put a little bit of sea salt in your water. Okay, it shouldn't raise your blood pressure because it's got potassium and magnesium that also lowers blood pressure. The other thing is you want to make sure that you're consuming mainly meat and vegetables. So where half of your plate, pretty much every time you sit down, is vegetables. So decreasing the sugars, decreasing the grains, decreasing the dairy. So focusing on that. And if you're not eating meat, that's fine. Eat beans, pinto or 100% protein. So you can vary it that way. But vegetables are the main thing. And then if you're tired, usually you can't do much movement, but if you can do 5 jumping jacks a day, 10 jumping jacks a day, that's kind of the first thing. And I call that a level 1 problem. If you can fix your fatigue by doing lifestyle habits, then that's a level 1 problem. If you still have fatigue at that point, then you need to start in on the big 3, optimizing adrenals, thyroid, mitochondria, and then some of the other ones. And if you fix your fatigue after that, then that's a level 2 problem. If you still have fatigue after that, then you're looking at removing the toxicities that we talked about in step 4. But that should help give you some information to get started.
All right, great. Well, hopefully that helps, Jessica. And so you mentioned refined sugars. Do you find also a lot of people talk about, or a lot of practitioners talk about, but then also a lot of people do things for like candida overgrowth. So do you find that also is a big factor when it comes to fatigue?
Yes. In terms of, once again, it's all about the causes. So some people might have, in terms of like percentage, a lot of people have yeast overgrowth.
Mm-hmm.
But it's also about total body burden and what is the biggest priority. So we always go by symptoms as a guide to determine, what's going to be causing the biggest issues. And I find that yeast, yes, it will cause some fatigue, but not as much as some of the other infections. So oftentimes we're addressing some of the other infections, the stealth infections first, before we go after the candida, unless somebody's got really bad itching, anal itching, ear itching. Now, what's interesting too is that sometimes those are fungal symptoms, which means they could be mold or yeast. So, depending on what we find in the stool, as well as what their gastrointestinal symptoms are, would determine whether and how high of a priority that becomes.
All right, cool. Thank you for answering that. And then, all right, so Heather asked, does Norway's, the person from Norway, she said she's dizzy. Does it meaning vertigo is what she was asking. And
I'm thinking so. I mean, there's other dizzy type symptoms that can happen. There's postural hypotension, where basically you go from a sitting to a standing position or lying down to a standing position too fast and you get lightheaded. That's more of an adrenal issue as opposed to the chronic vertigo. You can also, what's kind of crazy too is that, there are certain techniques that you can do going in to see your doctor's office or a neurologist where they can reset some of the cochlea or some of the in the inner ear. Sometimes the salt balance in there gets dysfunctional. When I was in residency, I remember this very clearly. There was a woman who was from Spain, and she had vertigo for 30 years. And so I was like, well, let's try an Epley maneuver, which is something that I had just learned. Nobody had ever thought to do it on her. We did it on her a couple times, and like her vertigo's gone. So sometimes it's simple stuff like that that can really help. And so you want to make sure that you're not ruling that out.
All right. So we have Dorinza here. So, hi, doctors. Nice to see fellow functional practitioners giving their genius to the world. Keep up the great work. I started my career as a research immunotoxicologist in the field of autoimmunity. Then I became sick with 7 autoimmune diseases myself. Now I'm healed thanks to the latest science. Everyone listen to these doctors. Functional medicine works. All right. Well, thanks, Dorinza. And yeah, the functional medicine definitely does work. And appreciate you posting that. And okay, so Rose. So hi, Dr. Osansky. You probably see me here a few times. Yes, I have. Thank you for showing up today as well. So it's been a crazy ride trying to figure things out. I've been in remission with Graves for about 3 years. My new diagnosis is Hashimoto's. I just had allergy testing, and my IgE so far is high for milk, egg whites, and wheat. My C1 esterase is high, and then positive EBV, Epstein-Barr virus reactivated. I'm thinking this has caused my autoimmune issues. So yeah, kind of, as you said earlier, doc, just, it could be one factor, the Epstein-Barr, and, then also what's causing the Epstein-Barr, because most people have Epstein-Barr in their body. So it's usually not just an Epstein-Barr problem. It's usually other things affecting the immune system, causing the reactivation of Epstein-Barr. But not sure if you want to expand on this.
Well, I think what's a good reminder too is that, autoimmunity is a spectrum. It starts off, the immune system is reacting to something, and that's an allergy. And then if that thing gets inside of some tissues in the body, and the immune system starts acting against it or reacting to it, that's when you get autoimmunity, where it's actually attacking the self. And so it's important to remember that those allergies that you have are because of whatever is triggering the immune system. So whether it's Epstein-Barr virus or mold or a combination of those toxicities, they're all going to be triggering the immune system, and you're going to have allergies, and you're going to have autoimmunity to muscles, and you might have muscle pain, to brain, to fat, to like whatever it is going to then cause your symptoms. So definitely focus on what is, that Epstein-Barr virus. That's definitely a good path to go down. Just make sure that you're addressing all of them. I think what's important too to remember is that the immune system, a lot of this testing that we're looking at for infections is called serology testing, which is looking at the immune system's reaction to something. If the immune system is not functioning well, guess how valuable those tests are? Not very valuable, right? If the tool that you're trying to use is dysfunctional, then you're not going to get great tests. So if you get a positive test, if you get a reactivation of Epstein-Barr virus, that is really affirmative, indicating that yes, it is highly likely that that's an issue for you. If you don't get one, it doesn't necessarily mean that you don't have it there. One of the things I like to do sometimes if there's any question about some of these Lyme type infections, is doing a urine PCR test. So this is looking at the DNA of the infections in urine. Unfortunately, it's a $650 test, but that can be helpful to actually see the bug itself instead of looking at the immune system's reaction to the bug.
All right. How about looking at doing just a separate test for serum immunoglobulin? So if you get like negative EBV markers and just doing immunoglobulin G and immunoglobulin M, and just making sure. And if those look good, would you say that the test is probably accurate, or is there still a chance that it might be a false negative? Or?
Yeah, that can definitely help to determine. But I also think that we're really at the early stages of testing. A lot of we rely very heavily on blood testing, and serum is actually, most of the active stuff that we're looking at is actually inside the cell, and that's not what we're testing for. We're testing for what's floating around outside the cell, which could be 30% of actually what's happening. So it's just not the best representation, but that is one way to determine whether or not somebody has normal immune system function. Though, if they do have autoimmunity, by definition, they just wouldn't have normal immune system function. So if you've got a number of the immunoglobulins present, that's great, but they still could be reacting. They still could be autoimmune in their activity.
All right. No, great. And then we got Rose just with the follow-up. Thank you. I'm going to get IGENX test to rule out all Lyme disease. So yeah, the IGENX is, which you're probably familiar with IGENX, a specialty lab that focuses on Lyme. And
I'm
yeah.
not a fan just because of what I said. It's a serology test, so it's looking at the immune system's response. And it's very hard. You can have all those symptoms that I mentioned of Bartonella, and it may still show up as not having Bartonella. And then somebody doesn't get treated for Bartonella, and then guess what? They continue to have problems with those symptoms from Bartonella. So you have to remember to always include, the lab is such a small part. Even in conventional medical school, I was taught that history and symptoms are 90%, and then labs and physical exam are 10% of your diagnosis. And so you have to always remember that. And so make sure that you're looking at those symptoms more than you are the labs.
All right. One other question. Sticking on the topic of labs, CBC, doing a complete blood count with differential. Obviously, that alone is usually not going to be give you everything you need. But how much do you pay attention? Like if someone does have persistently low, white blood cell counts, or if they have like elevated lymphocytes, or just imbalance of the neutrophils lymphocytes. Do you use that at least to like where if it's normal, I know you can't just go by that and say, oh, the person doesn't have an infection. But if there are imbalances, does that maybe give you some clues, or you don't really even look at that?
It's confirmatory. So it can be helpful, but once again, it's not the cause, it's more of a consequence. So yes, the immune system is going to be off, and levels are going to be lower or higher based off of whatever kind of infections are present. Now, the main thing that I'll use the CBC for is going to be MCV, so mean corpuscular volume, looking at the size of the red blood cells to determine, whether you're looking at iron deficiency or whether you're looking at B12 or folate deficiency.
Yeah, that RDW as well. Like if that's usually an iron deficiency, you'll see that higher. So you look at it, maybe you look at MCV more, or.
Yeah, well, I don't really look at RDW. If I'm looking for iron, I'll also combine the MCV with ferritin as well as the TIBC. I think the TIBC is the most accurate marker, the iron binding capacity. And so that's kind of inversely proportional to the ferritin. And so that's going to be elevated when the ferritin is low. Ferritin can also be an acute phase reactant, as you know. So oftentimes if you've got inflammation and ferritin is like 150, all bets are off. So I'll combine some of those. So it's really kind of like a 2 out of 3. if TIBC is high and MCV is low and ferritin's kind of off the charts, then I'll still say, well, yeah, your iron is on the lower side of things. And I'll try to do it with diet first, depending on how low it is. And then I'll use some of the herbal iron supplements like we talked about.
Mm-hmm. All right. And this will be, I think, the last question because we're almost at 3 o'clock. So Benita, just had to have my gallbladder removed. How does that relate to Hashimoto's? So I do have Benita on my website. We'll see what Dr. Hirsch has to say, but I do have some articles on bile metabolism, talk about the gallbladder, because obviously getting the gallbladder removed, sometimes it is necessary. So, you know, it might have been, definitely might have been necessary, but it doesn't take care of the cause why the gallbladder needed to be removed. But do you want to expand on that?
Sure. So what I've found is that upwards of 95% of all gallbladder issues are allergy related. So there's some sort of the gallbladder is spasming because it's reacting to usually a food that you're consuming, whether it's gluten or dairy or sugar or whatever. And so the way that correlates is that Hashimoto's is an autoimmune condition. Autoimmunity is also going to be exacerbated by anything that you consume that you have an allergy to, or anything that you come in contact that you have an allergy to. So that's where I would say that there's a correlation there. If you've got both of those things going on, gallbladder issues, you had that removed, as well as Hashimoto's, once again, it comes back to those toxicities. And there's something that's triggering your autoimmunity triggering your immune system to have allergy and autoimmunity to the gallbladder, to the thyroid, and I'm sure to other parts of the body. And so it's find the cause and remove it.
All right. And all right. So Jackie, just want to say thank you for this information. Thank you, Jackie. Thank you for tuning in. And thank you, everyone, for attending, for tuning into this call, and appreciate Dr. Hirsch taking time out of his schedule. And just don't forget, you could download a free PDF copy of his book. Again, this is in the Facebook link, at least in the pages, the 2 pages it's live streaming to. The group, I will put it in manually. And I also plan on sending an email out as well, because I know some people weren't able to attend this live. And all right. And Tanya, thank you. Have a good night. Thank you and Benita, thanks so much. And Rose says thank you. All right. So we have a lot of thank yous again. Thank you, everyone. Again, this probably will be the last Facebook Live. Yeah, I guess the new year is 2 weeks away. So, and usually I do these on Friday. So definitely won't be having one next Friday for obvious reasons, being Christmas Day. So yeah, well, so first of all, I want to just again thank Dr. Hirsch one more time for taking the time out. Appreciate all the advice you gave, and again, make sure you visit his website, download his book, and just want to wish everybody a happy holiday season, happy New Year, and we will I will catch you again in early 2021. All right, well. Take care, everyone. And again, thanks again for attending.